It's become apparent in recent years that the medical field doesn't know what to do with people with autism. Diagnostic methods improve, and yet treatments aren't catching up. Why? It's become apparent in recent years that the medical field doesn't know what to do with people with autism. Diagnostic methods improve, and yet treatments aren't catching up. Why? There are very apparent gaps in autism spectrum disorder research in minority populations, especially in adults. For autistic individuals and those with many autistic traits, this transition to adulthood can be challenging. Typically, family and professional support become less available. Nevertheless, most scientific research on these individuals has focused on childhood and adolescence. If the research is not there, then how can there be a development of therapy? Only around 0.4% of indexed research on autism since 1980 has focused on autistic people in midlife or older. Because of this, there are almost no treatments for autistic adults. Currently, common treatment methods for ASD include pharmacological treatment, behavioral treatment, interventions, neuromodulation techniques, and complementary alternative medicine. Because of this, there are really almost no treatments for autistic adults. Currently, common treatment methods for ASD include pharmacological treatment, behavioral interventions, neuromodulation techniques, and complementary alternative medicine. Clinical practice and public health systems currently only really consider early intervention to be effective for treating autism. Clinical practice and public health systems currently only really consider early intervention to be effective for treating autism. And although I mentioned some treatment methods before, all but one focuses on behavioral correction. Pharmacological treatment is only to treat irritation in children with autism. It consists of giving them antipsychotics and sedatives to be able to handle the kid. Early behavioral interventions are basically the golden standard of autism treatment, and many autistics and neurodiversity proponents compare it to conversion therapy and report being heavily traumatized after undergoing this. Thus, all approaches to autism intervention and research should consider the notion of benefit in terms of well-being and autonomy when it comes to treatment. The systematic gaps in autism research in understudied populations is causing a public health crisis, and the system seriously needs to reconsider how treatment and research efforts should look like moving forward. I talked about common treatment methods before, and one of the ones that I wanted to delve deeper into is complementary alternative medicine, which are less scientific approaches to treating autism, but although they are less scientific, they focus more so on the well-being and the benefit of the autistic person. There's a subsect of this type of therapy called animal therapy, where horses are sometimes used. I had a chance to interview and visit Fundación Bienestar Equino Epona, which is a foundation here in Panama. This foundation's main mission is to rescue and rehabilitate horses that come from the hippodromo that were already set to be killed, to give them a second life and to use for therapy or to give them away for adoption. They house their horses in a ranch near Tocumen, where they also host their regular classes and animal therapy sessions for special needs kids. These sessions are tailor-made to get the kids to move around, gain confidence, and promote communication. So let's get our boots on and go pay them a visit. Low-key ignore that my room is a mess. Go do an interview with my aunt. By the way, yes, my aunt is the founder of the foundation. This is how I know about the foundation. I used to work there. Currently, she has, I think, one other employee, but when I worked there, it was the one other employee and me. I used to do a lot in this place, so currently she handles most of the work on her own, and she helps take care of the necessities of the horses out of her own pocket. So okay, I'm here with the founder of the Fundación Bienestar Epona. What is the foundation about?
Okay, I have a foundation that is called Epona, and it's got what we is like we save horses from the racetrack that they don't race anymore, and then we go and pick them up, and then most of them we usually use them for the special need kids, or maybe if there's something wrong with the horse, we take them to the interior of the republic so they can become a better horses with the other ones, like a better breed.
And finally, in what ways have you seen that the therapy helps the kids improve?
Well, I've been a lot of changes in kids, especially with the self-esteem, equilibrium, self-confidence. They start to walk, they start to talk, and they love it, and they feel, like they are doing something good for them.
Unfortunately, I did come on a day where there weren't any classes scheduled for any kids with special needs. So all of the video footage is going to be of regular classes. I couldn't get any footage of like what the actual classes look like. They're very similar, but usually they're made or structured in a way to encourage the kids to communicate while they're distracted on the horses. They also have games that they play with the horses where you have to like collect ranks and stuff. And she also tries to teach the kids communication and like basic like school things that they would learn in their school life, like the ABCs and word association and wordplay. It's the end of the video. Thank you guys so much for watching. I had a very fun time. Thank you.